This recording will go over increasing functional ability and also identifying and managing dysrhythmias. The patient is expected to increase functional ability without chest pain and the need for supplemental oxygen as a result of a collaborative cardiac rehabilitation program. A planned program of cardiac rehabilitation increases functional ability and tolerance to activity. Cardiac rehabilitation is implemented primarily by the nurse and cardiac rehabilitation specialist and is continued after discharge. Cardiac rehabilitation is the process of actively assisting the patient with cardiac disease in achieving and maintaining a vital and productive life while remaining within the limits of the heart's ability to respond to increases in activity and stress. During cardiac rehabilitation, assess the patient's heart rate, BP, respiratory rate, and level of fatigue with each higher level of activity. Decreases greater than 20 in systolic BP, changes of 20 beats per minute in pulse rate, and/or reports of dyspnea or chest pain indicate intolerance of activity. If these manifestations develop, notify the healthcare provider and do not advance the patient to the next level. Older adults with coronary artery disease often have needs and concerns different from those of younger adults. Please review Chart 38-5 on your own. The most desired outcome for the patient is that he or she will be free of dysrhythmias. If dysrhythmias occur, they will be identified and managed early to prevent complications or death. Dysrhythmias are the leading cause of pre-hospital death in most patients with acute coronary syndrome. Even in the early period of hospitalization, most patients with acute coronary syndrome experience some abnormal cardiac rhythm. When a dysrhythmia develops, identify the dysrhythmia, assess hemodynamic status, and evaluate for discomfort. Dysrhythmias are treated when they cause hemodynamic compromise, increase myocardial oxygen requirements, or predispose the patient to lethal ventricular dysrhythmias.